thanks for being here, and I'm excited to share a little bit about what we do as Healing Rhythms Music Therapy in the community. My name is Christina Wood, and I'm the owner of Healing Rhythms, and I'm excited to also introduce to you Kristen Carter. She's one of our staff on our team here. So I'm curious, I'm going to start with a story. How many of you have ever had a loved one, maybe a grandparent or somebody else in your life that has dementia, and they might not remember who you are, but have you ever noticed how they remember songs, and they can maybe sing with you even though they might not know your name? Or then maybe you're a parent and you've had a child in the hospital or another loved one in the hospital, and that chaos and the sickness. But have you ever noticed how music can transcend the chaos and sickness and bring a sense of peace and calm and normalcy? So that is something that our team is honored and humbled to do every single day, using music in some of life's most fragile moments to empower, to make a difference, and to really figure out how do we use music to help people. Well, that's what we do. So I am one of 8,500 board-certified music therapists in the U.S., and I'm guessing many of you never knew that music therapy was a college degree or a career path, right? So yes, you have to have a degree in music therapy, minimum of a bachelor's. In some states you need your master's to practice, but in Minnesota just your bachelor's. And then like any other allied healthcare profession, clinicals, and then a 6-month board or 6-month internship, and then you have to be board certified, so pass your boards to practice in the U.S. And so what do? We really figure out how do we use music to help people regardless of their age, their ability, or maybe their disability, because we always say music transcends and overcomes all disabilities, and we look from a strengths-based approach. So when I started my career, I knew that I always wanted to be in the medical realm and use music to help people that way, because I knew from personal experiences, from my grandparents being sick, from seeing people struggle with mental health in my life, and my own personal struggle with health, music can be really transformative in terms of integrative and holistic health. And so looking at the medical realm and how does music fit? So I was very honored to start as a solopreneur in the Twin Cities, started the first pediatric music therapy programs in the state up there, and then took a leap of faith and moved to Rochester and targeted, I started medical music therapy programs at Mayo Clinic. But about that time I realized, 1, there was much more work than I could do myself. 2, my friends and colleagues that were working were in isolation. And 3, many of them were burning out. So why not rebrand into Healing Rhythms and build a cohesive, comprehensive team that's really strengths-based and that we can do more together, right? And so that's really where I started in 2013, based in Rochester, is rebranding into Healing Rhythms. And healing, because we don't always have a medical cure, right? But healing can happen emotionally and spiritually through music and with music's help. And rhythms, because your heart, and we're innately rhythmic human beings, your respirations, not just the music aspects. And so really looking at how do we use music within the medical realm, the mental health realm, to empower, to promote wellness, that type of thing. So what started as just me is now a team of 12, and I'm very excited that our focus has been to increase access. So that looks very different in the rural areas, because my vision was we should be able to increase access to music therapy services in rural outstate greater southern Minnesota. You shouldn't just have to be in the Twin Cities or metro area to receive access. So we really took a leap of faith and started partnering with organizations to bring services to them, assessing what are the needs in the community. And that's really been our focus. Last year in 2019, our team served over 15,000 people across 18 counties in southern Minnesota. So we now have 10 music therapists, a massage therapist, and an office manager to do our work and to partner to increase access. But what does that look like in the greater Mankato area? So in 2017 we took a leap, and I really wanted to focus on this area. And so we have a partnership with Mayo Clinic Health System Hospice, and so we provide all their staffing and all their services for hospice patients and families. But in addition, we partner with other organizations such as Mankato Public Schools, working at their Futures site to provide services to those students. And then we do go into homes and we serve kids and adults with disabilities and looking at how do we use music to help them as well. And so it's really looking at, as we have grown in this area, what truly are the needs and how do we best serve them. And so that's really what the focus has been in growing into this greater community. And so our work looks very different on a day-to-day basis, depending on what we do. But again, it's how do we educate the stakeholders, the patients, the families that might need access to services? How do we help advocate about what it is, and how do we get them services, and how do we grow and scale in a more rural area? So we've really focused on how do we truly support the needs of the community through music. Again, those community partnerships, so we go into organizations and we provide maybe groups in a senior living facility twice a month, or maybe we provide all the staffing at an organization that they might need, large amounts of hours per week. We're out educating and advocating about what is music therapy, and maybe they don't work with us, but maybe that's an awareness, and then they decide that they need a music therapist. And networking, just sharing our story of who are music therapists, why would you want access to one for your loved one, and what does that look like? And then how do we scale? Joining Greater Mankato Growth, being here, going to other advocacy and networking events, trying to be at health fairs, things like that, of how do we spread the message, and how do we continue to assess that need of this community. And so then, how do we plan? How do we plan for the future when we're growing in an area that has never had this service before? And so again, how do we scale it out of Rochester, out of the metro, into Mankato, and then down? Because we do serve 18 counties, and so in this area we serve up to Le Sueur, down to the Iowa border, and then over to the I-35 corridor. So our footprint is pretty large in this community. And then does our business growth and model fit here? Or do we need to do things differently? And then looking at what is our ongoing funding access, as we're working with a lot of seniors, hospice, Medicare cuts, things like that. What does that look like? How do we get creative? And how do we overcome the challenges that we're constantly faced with day to day? And honestly, it's a lot of how do you pick up and fail forward and have that grit to move on, because every community, every organization is different, and we really want to figure out what are your needs and how do we best serve them. But honestly, some of our challenges have been great. Awareness is actually our number one, how do we educate about what it is that we do? And then funding is always a challenge when you're working in healthcare, mental health, special needs populations, things like that. But it's being creative, and and the news station offers you a 6 a.m. time slot, and you live in Rochester, you take it. And we should have carpooled this morning. So we're always looking for how do we partner. And so that brings me to my last point of what can you do to help, because I know that's one of our favorite questions. Tell our story, help people share, and help us become this success story. This little girl, that's when I met her, in her mom's arms in the ICU, using music to help. And now she's thriving, and she's seen in our clinic, and we've been able to follow her for 5 years and track her progress, learning to walk, learning to talk, and learning to be a normal child empowered through music. But also help us with your connections. Who do you know? Administrators, stakeholders, caseworkers, social workers, things like that. It's word of mouth, right? That's honestly organic growth is what we've seen, because we really want to be serving truly the needs of the community. Because I still call this home. I'm a Truman graduate. I'm proud to be a farm girl at heart, and I really want to bring these services into our community. So with that, I thank you for your time and your attention, and I welcome any questions that you might have at this time.